Hey, everybody. I know Fridays are not typically days that we usually do these chats about health content writing, but I know many of us are at the start of a long weekend. And so I thought this might be a timely opportunity to talk about a value that I think many of us as professionals have or a value that we hold, but that we don't always have in our careers or our chosen professions, especially as healthcare professionals, healthcare providers. And so today I thought it would be really great to talk about work-life balance, and specifically how to secure that work-life balance that you're trying to achieve through writing and communications work, and specifically through freelance health content writing. So, for those who I might not have had the opportunity to meet before, my name is Megan. I am a public health pharmacist turned health content strategist, and I run a program called Health Professionals to Health Writers that helps fellow health professionals, US based pharmacists, and other healthcare providers learn how to replace a portion of their primary income through freelance health content writing. And so we do these chats most times on Wednesdays, every Wednesday, but today we're coming in on Friday to have this conversation. So a little bit of a story about how I learned that certain aspects of a work schedule were high priority for me. And let me know in the comments if any of this story resonates with you. So when I was a student pharmacist, I was in pharmacy school. I attended pharmacy school at Mercer University, which is located in Atlanta, Georgia. And I had a really, really wonderful work opportunity as a pharmacy student. I worked at Children's Healthcare of Atlanta in the pharmacy department, and I actually got that job literally the March of my senior year of college. Is when I found out that I had secured that position, and I was really excited about it. I went to undergrad at Emory University, which is right across the street from Children's Healthcare, or CHOA, as we affectionately call it. And so I was really excited to be able to have that learning opportunity so early on in my pharmacy journey, because I knew that working through school and working at CHOA at the same time would really help me in my career. So I was really excited about that, and I was able to hold that position throughout all 4 years of pharmacy school. In that position, because I was in pharmacy school, right? Like, I didn't have weekday availability to be working at CHOA. And most of the times when there were students working in that position, we worked on weekends. And so we worked every other weekend. And we were also in the holiday rotation. So that meant that every quarter or so, when you kind of looked at all the holidays, the major holidays on the schedule, of course, staff is needed, right? The pharmacy still has to be staffed, even though it's a holiday. The hospital does not shut down. The kids still needed us. And so we were working every other weekend, and we also would occasionally have holidays that we needed to work. And I totally understood, the nature of that role. I wasn't, that did not catch me by surprise. Like, everybody knew that going into it. But being in a position where that was my schedule for 4 years, and where every year I was kind of worried about, oh, am I going to have to miss Christmas this year? Am I going to have to miss Thanksgiving this year? Being in that actual situation made me realize that this was something that was important for me in my future career, that I did not want to be in a place where I had to work weekends or I had to work holidays. Before I even decided to go into pharmacy, I was considering going into medicine. And one of the reasons that I pivoted paths, which I know that a lot of fellow pharmacists can relate to, as we started out having an interest in medicine, but one of the reasons that I chose not to go that route is largely for lifestyle reasons, right? I didn't necessarily want to commit to the years of training that would be required in order to become a physician. I didn't necessarily want to be in a position where I needed to work weekends or be on call consistently or work holidays. And again, like totally understand that this it's necessary, right? Like it's not like we don't need physicians and other healthcare professionals to be around at all, 24/7. We definitely do. It's just that for me, I did not necessarily want to be the one to have to do that. So that directly impacted my decision to go into pharmacy as opposed to medicine. And so when I found myself in this position where I was working every other weekend, working holidays, I thought to myself, okay, if I wanted to do that, I could have just gone to medical school. Like I could have stuck with the original plan. But I chose not to for a reason. And I don't want to have to do that in my pharmacy career either. I had a similar thought process around completing a residency program. If I wanted to do a residency, I could have, or, a clinical fellowship, I could have just gone to medical school to do that. And so I tell this story so that you have kind of a picture of how I realized what work-life balance meant to me and what I needed in a position in order to feel like I had that type of work-life balance. And that value and that description and definition of work-life balance is going to be different for different people. So you might share the same kind of sentiment that I had and have, or you might feel completely different about the type of work-life balance that you need in your life, in your career, and what that looks like, right? So we are not the same people, but some of us might share that same value and that same definition, and some of us might not. If you are a person who does share that same value and definition, then this this conversation is going to be highly relevant for you. Um, I think that what is important to start off with is by asking yourself that question, though, if you are not sure. What is important to you when it comes to the values in your life and in your career, your professional trajectory, right? What are the values in your life and in your work? Because it's hard to have that balance between life and work if you don't know what you need out of both of those settings, and what you need in order to feel that balance. So it really requires you to take a step back and say, okay, what are the things that I need? What are the things that are non-negotiable? And what are the things that are like nice to have, but if I don't have it, I can work with that. For me, a non-negotiable was like weekends and holidays need to be off. It's not gonna work for me. Thank you, Relinda's. Hi, Kingsley, Joseph. So that is a core question to ask yourself in order to figure out what aspects of work-life balance are important for you. When it comes to how health content writing specifically offers work-life balance for me and how I found that in this line of work, there are a few characteristics of this type of work that lend themselves well to having that type of schedule freedom, if you want to call it that, or just like not needing to work weekends and holidays. Um, the first thing is that as a writer or communicator, like whether you're a medical writer, health communicator, kind of whatever writing and communications umbrella you fall under, usually you have a regular schedule, right? Or a traditional schedule where you might work in an office setting or work remotely or like wherever, but it's pretty much like 9 to 5. And I say that not literally because I don't think I've ever worked a 9 to 5 schedule, like maybe 8 to 4, something like that. But traditional work hours, pretty much 9 to 5. Now, obviously, this is going to vary depending on what type of medical writing or work setting you are in. But overall, especially if you are comparing this to a traditional pharmacy role or healthcare provider role, there's much more consistency in the hours that you're going to be working. Totally, totally relentless. Yeah, I definitely understand. And so that is one of the pros, right, with health writing is that you can kind of go into it expecting that if you have a traditional like employer-employee health writing job, you're probably going to be working some regular hours. And that allows you to build um, build your life around those hours that you are going to be working. So that's one pro. The second thing is kind of related. So because there is more consistency in the hours that you're working, um, it also makes work more predictable. And by predictable, I don't just mean like you kind of know that regardless of what day, what week it is, you're going to be working from, 8 to 4, 9 to 5, or whenever. But it also means that the projects and the actual like deliverables, roles, responsibilities of your work are also more predictable. Um, a close family member of mine used to be a teacher, and they were always frustrated with the fact that they could not, there was no getting ahead, right? There was no way to say, all right, I know that I want to take a vacation from Tuesday to Thursday next week. So I'm going to get ahead on my work so that I can be done and like free to take my vacation and not have to worry about all the work that's waiting for me when I get back. Or they couldn't say like, I have a doctor's appointment this afternoon, so I'm just gonna like get ahead on work this morning, and then I can go, do my doctor's appointment and I'll be fine. That teaching is not a profession that you can like get ahead on. There's always something to do in that specific moment, and that is very similar to the way that I think about a lot of our healthcare professional careers. There's always patient care that needs to be done in the moment actively. So yeah, you may be able to get ahead on some um not certificates, what's the word I'm looking for, like your annual certifications or tests or things like that that you have to do. Maybe you can get ahead on some documentation, but the patient care that you're doing on a day-to-day basis, like that's not something that you get ahead on. You have to do that in real time. Whereas with writing and communications based work, that is there's less real time involvement. So it makes it more feasible for you to be able to know what projects you're working on next week or next month. And so you can plan ahead, you can manage your time and your projects so that you're doing things at a certain pace. You can kind of predict what might be on your plate at certain periods of time. And now, please note that all of these pros that I'm giving, I'm generalizing, because depending on what type of writing and communications you're doing, there might be times when you do have to be more active, like at the moment. If a crisis situation happens, or something like that, there may be times when you have to do things in the moment, or things might pop up. But overall, the schedule and the work is more predictable than what we would think of traditionally as healthcare providers. The third thing that I want to mention in terms of how health writing offers work-life balance is that, so thus far we've been talking about writing and communications based work that is like your traditional employee W-2 job, right? 9 to 5 traditional job. And so yes, there is a level of time freedom or schedule freedom that happens with that 9 to 5 style job. But when you think about health writing in the context of freelancing, then um, that's when you really start to be able to embrace all of the benefits that come with the time freedom of being a writer. And that is because as a freelancer, you are not tied to it, usually, again, generalizing, but usually you are not tied to any specific schedule, right? You are not 9 to 5ing anything. Like, even though 9 to 5 is predictable and that's great, especially in comparison to some of the schedules you might be used to as a pharmacist or healthcare provider, right? That's one step. But then when you take it to the step of freelancing, there is even more autonomy there over your time, because you are usually not being required to work during specific hours, right? You have contracts with different companies to say, I'm going to write these pieces of content, or these articles, these scripts, these emails, whatever it is, for this company. And at the end of the day, the company just needs the product when you say you're going to have the product by. But they are not your employer. So they are not dictating when or how you complete that work. They're not saying, I need you to be working on this on Tuesday from 3 to 6 or on Wednesday from 9 to 12. This is the project. This is when we need it by. These are all, the details to know about what we need. Please have it to me by this date, right? You, as the freelance writer, dictate when and how that work gets done. So that is why I kind of differentiated between your traditional W-2 employee medical or health writing type of role versus a freelance medical or health writing type of role. There is a big difference in the autonomy and the time freedom that you have in those types of settings. And so if we're looking at like the hierarchy of time freedom that is available, being in a position where you're able to freelance your skills is kind of at the top of that, of that pyramid. So taking a step back after we've talked about those three ways that health writing kind of brings you work-life balance, offering a more traditional regular schedule, work being more predictable, and then if you are a freelancer, having the freedom to be able to work on your own schedule, on your own time. What is going to be important is for, again, you to get familiar with all of the different types of medical and health writing that exist. And that is because, again, in this conversation, we've been kind of generalizing, but not all medical writing and communications work settings operate the same way, right? So if you are working for a medical communications agency, for example, an agency is oftentimes going to be more fast paced. There's going to be more people involved. There are going to be more people to answer to. There's going to be more pressure oftentimes in that setting than if you are working as, like, say, for example, a drug information specialist or a health content writer, et cetera. So there are little differences between all the different types of medical and health writing. They are not all created equal. The settings and the environments and the priorities are not all created equal. So that's another reason why when we talk about work-life balance, I really hone in on the fact that if that is something that is really important to you and you're passionate about some type of writing or communications, health content writing, and especially freelance health content writing, is going to be the type of medical or health writing that I really think you should, look more into and kind of focus your interest on, because that is one of the types that will be able to offer you more of that time and schedule freedom that you're looking for. Someone asked about a replay. Yes, there will. So if you just come back to this post, any of these videos that we do every week, you can always just come back to my profile and you will see the videos in my feed. There's also, these videos also go over to YouTube. So the channel is called Health Writing for Health Professionals. And you can see all of the videos, all of the conversations that we've had on here. They're the exact same. They happen on LinkedIn and on YouTube. So great question. I think those are most of the things that I wanted to cover today. I will say that, again, if you are interested in medical or health writing, and this is kind of your first time hearing about it, what you want to do is start by learning about what the different types of medical and health writing are, right? You can do that on the Health Writing for Health Professionals YouTube channel. There's a playlist called 9 different types of medical and health writing or something like that. You can learn about them. Also, again, you want to think about what is important to you in terms of your values in life and your values in work, because once you understand what those values are, you can identify what you actually need in your career trajectory in order to get the work-life balance that you're looking for. And then if you determine that health content writing is something that you might be interested in on a freelance basis, then you can always leave a comment with the word "write" and I can send you more information about the Health Professionals to Health Writers program, and we can get you signed up for the waitlist as well. So thank you all for attending today, for joining in the conversation. Again, you can always catch the replay on the LinkedIn page or on the Health Writing for Health Professionals YouTube channel. Comment the word "write" if you are interested in joining the waitlist for the Health Professionals to Health Writers program. And leave a comment if you have further questions. I'll be happy to answer them in the comments later. So enjoy your long weekend and be safe.